Hey you guys, it's Kim Gartman here. It's time for 5 Minute Friday. As you know, I'm a independent consultant with Arvon, a practicing family practice physician. And today what I want to talk to you about is something that I've been learning more about over the last couple of years, and something that's really critical for our health, and that's magnesium. Magnesium is a mineral that is integral to hundreds of reactions in our body. It's so critical to protein formation, how our body breaks down and utilizes energy, fuels our cells. It's really important for creating and repairing DNA and RNA. Y'all, that is a big deal. Damage to DNA is what turns on genes that causes cancer and also causes other autoimmune problems and illness. So it's a big deal. Also aids and is critical for muscle movement. In fact, when I have patients come into my office complaining of cramping, they're thinking potassium and I'm thinking magnesium. So I usually have people supplement with magnesium if they're having muscle cramps. Also, it's very, very critical for nervous system regulation. So that means like nerve functions, which makes body movement, it controls pain, it also controls our mentation. So if our neurons aren't firing correctly, we can't think right and our muscles can't move right, so on and so forth. We have increased pain, that type of thing. It has actually been shown to boost exercise performance. Just 250 milligrams a day of supplementation can boost exercise performance. So if you're a big exerciser, consider a little bit of magnesium. It also helps to fight depression. There's actually some studies and some belief that some of the increase in depression is twofold. One is decreased levels of magnesium and also inflammation in our body. Well, guess what? Magnesium helps with inflammation as well. So it's a big deal for helping to fight depression. There's actually a randomized controlled trial, not just anecdotal data, that showed in older adults, if they had a 450 milligram supplement daily, it improved their mood as well as an antidepressant did. It helps with diabetes, and I found several studies that showed this. So people who get adequate magnesium have a significantly lower risk of developing type 2 diabetes, and it also reduces insulin resistance. And so what happens when we're insulin resistant is we're getting too much sugar usually, and our body produces a lot of insulin, and so our cells are like, time out, had enough. And so what happens when all that insulin's floating around is it tells the kidneys to dump magnesium, and so if you supplement, it can counteract that. So that's great. There have been some really good studies, including the Framingham Heart Study, which is a huge heart study that showed that magnesium supplement reduced blood pressure and also reduced the risk of heart attack or stroke. Mostly we think it's because of its anti-inflammatory benefits. So that is huge, you guys. Also can help with migraine, which is a big deal. I see tons of patients that have refractory migraine that aren't controlled with medication. They're really struggling, and magnesium can really help with that. It also can help improve PMS symptoms, not just the moodiness, but also the bloating and water retention. It has been also shown to help improve with osteoporosis because it helps in bone formation. You guys, magnesium is safe. If your kidneys work good, you can take magnesium and it's very hard to overdose. You could, but you would have to take a ridiculous amount. And the daily recommended intake of magnesium is about 420 milligrams, and you'd have to take a whole lot more than that to have a problem. Generally, the way to tell if you're getting a little extra magnesium or a little more than you need is if your stools become a little loose. That's generally how I advise my patients, and so you can just back off a little bit. But I'm encouraging patients regularly to take magnesium. There are a very small handful of medications that can interact with magnesium, so check with your doctor before you start if you're taking medications. There's lots of ways to get magnesium naturally in your diet. Pumpkin seeds, spinach, Swiss chard, dark chocolate, hooray! Black beans, all kinds of beans really, quinoa or quinoa if you're raised in the South like me, halibut, almonds, cashews, mackerel, avocado, yay, sunflower seeds, which also have other really great health benefits, shrimp, and oatmeal. I'm going a tiny bit long, but y'all, this is really, really important because it really can impact your health dramatically. Make sure when you're doing a magnesium supplement that you look for one that says elemental magnesium. And then also another really great tip is that your magnesium is better absorbed if it's in a powder that's dissolved in a liquid. And so I'm going to post my 2 favorite magnesium supplement products in the comments below this, but feel free to do your own homework and research and take a look out there. The only thing that you need to watch out for is if you have chronic kidney disease, talk to your doctor before you supplement with magnesium. I hope you guys found this helpful. It turned into almost a 6-minute Friday, but we'll still call it 5-minute Friday. Thank you guys for joining me. I hope this was helpful. Be sure and ask any questions that you may have. I'd love to answer them.